Hello, everybody, and welcome to the podcast on multiple disabilities. There is no single definition to cover all of the conditions in the category of multiple disabilities. In fact, there is as much diversity among people who have multiple disabilities as people who do not have multiple disabilities. The IDEA definition states that multiple disabilities means concomitant impairments such as mental retardation, blindness, or mental retardation orthopedic impairment, so at least two, the combination of which causes such severe educational needs that they cannot be accommodated in special education programs solely for one of the impairments. Multiple disabilities does not include deaf-blindness. The general characteristics of people who have multiple disabilities, therefore, is very difficult to pinpoint because there's just as much diversity within the category as there is outside of the category. However, there's a wide range of general characteristics, and there are 5 general characteristics that we're going to talk about here that you can use to describe most of the people in the category. And these 5 general characteristics are intellectual functioning, adaptive skills, motor development, sensory functioning, and communication skills. And now we're going to talk about each one of those individually. So first off, we have intellectual functioning. As stated earlier, students with multiple disabilities vary widely in their academic abilities and intellectual functioning. However, most students with multiple disabilities have IQ scores that are approximately 35 points below the norm. In other words, about 65. If students do not have below average IQ scores, they may still be classified as having multiple disabilities because of their adaptive, sensory, or communication impairments. Next up, we have adaptive skills. And adaptive skills, as we have learned about already in class several times, include conceptual, social, and practical skills needed for functioning in typical community settings in age-consistent ways. Development of self-care skills is crucial for students with multiple disabilities. Specifically, dressing, personal hygiene, toileting, feeding, and simple household chores are necessary for people with multiple disabilities to function in the community. Next, we have motor development. Usually, students with multiple disabilities have significant motor and physical challenges. Some have underdeveloped muscle tone, and some have overly tight muscle tone, causing spasticity. Limited motor development often limits functional skill development, but therapies and mobility devices often help these students. Next, we have sensory functioning. Hearing and vision impairments are common among individuals with multiple disabilities. However, students who are labeled deaf-blind are individuals who have impairments in each of these senses that are so severe that they need specific instruction for deaf-blind students. They are not categorized under IDEA as having multiple disabilities because their programming is specific to their disabilities and they're their own category. However, students with multiple disabilities will often have impairments in one or both of these as well. And communication skills. Almost all students with multiple disabilities have communication impairments, and many have limited or no functional speech. Many students with multiple disabilities use augmentative alternative communication systems, also called AAC, which are discussed more in the chapter in depth and also in Chapter 6 in the book, and we will talk about them a little bit in tomorrow's class. So now let's determine the causes of multiple disabilities. Biological causes account for about 3/4 of the cases. Typically, there is a prenatal biomedical factor. Complications during and after birth can also result in multiple disabilities. Genetic factors and chromosomal disorders may occur spontaneously through basic alterations in genes, or they may be inherited. Fragile X syndrome is the most prevalent known cause of intellectual disability, occurring in about 1 in 4,000 males and 1 in 9,000 females. Usually with Fragile X syndrome, the intellectual disability occurs with other disabilities and therefore would cause the categorization in multiple disabilities. In class tomorrow, we will briefly review the definition of multiple disabilities, typical characteristics of students with multiple disabilities, and some of the causes of multiple disabilities. Then we will discuss some of the evidence-based practices for teaching these students. Please be ready to participate in our discussion tomorrow about these things, and we're also going to talk about the importance of inclusion to society. I look forward to our discussion. Thank you.